Okay, guys, this week for our post, I decided to look into interpersonal theory as one of the theories that we're not going to be covering over this semester. So we're going to look into it using the Ways paradigm, which we used a lot last semester as well. Basically, how the theory views counselors' way of being, how the theory understands how change happens, and how the theory conceptualizes how counselors help clients change and the tools that they use. So the definition that the Corsini and Wedding book gave for interpersonal counseling as a subject is a brief psychosocial intervention derived from IPT or interpersonal therapy intended to train professionals with no mental health background for the treatment of primary care patients with depression. So, from the initial information I got out of this from after reading through the text, was that this theory is very heavily focused on depressive symptoms and learning how to manage and cope with them. So that brings me to my first area, which is how the theory views the counselor's way of being. So I kind of view this as what the counselor focuses on, what they want to kind of establish with their patient or client, um, and that their main focus is on grief and interpersonal disputes, role transitions, and interpersonal deficits. Those are the four main components that make up IPT. So a lot of interpersonal disputes on one trying to figure out one sense of self and trying to figure out who one wants to be as a person can cause a lot of depressive symptoms. This also focuses on the recovery from current depressive episodes, so whatever is currently precipitating their depressive symptoms, by clarifying the relationship between the onset of the patient's current depressive symptoms and their interpersonal problems. So, kind of like what's going on in their life right now that could be causing these feelings. It also builds on interpersonal skills to resolve and manage more effectively with these interpersonal problems and kind of coming up with different coping mechanisms and ways that you can kind of express that kind of frustration without really damaging relationships or kind of damaging your own mental health. And it also allows the counselor to help those with mood disorders, different modalities, different cultural contexts and ages. When it comes to mood disorders, this one tends to be very helpful to those with things such as borderline personality disorder, bipolar disorder, unipolar depression. Those are just a few of the diagnoses that the book mentioned that this works really well for. And it really had a highlight on borderline personality disorder. And finally, the counselor educates the patient about depression, emphasizing that it's a treatable medical problem similar to other illnesses such as the flu or pneumonia, um, kind of desensitizing the patient to how they think that this might be way worse than it is and how it's a completely treatable, manageable thing to live with. You just have to put in the work and go and do the work to keep those symptoms at bay. So that brings me to how the theory understands how change happens. So this theory views that depression is conceptualized as having three different components. Symptom formation, so the formation of different depressive symptoms and how they come about. Social functioning, how you would function in a social setting or around peers, and personality factors, how personalities may change, how they could stay the same, kind of things like that. IPT has a phasic structure that is conducted in three different distinct phases. So the theory itself works out in the initial phase, the middle phase, and the termination phase, learning to cope with those depressive symptoms and kind of terminate that feeling for a little bit. It allows patients to take on the quote sick role, and instill hope in them about recovery and have them share their story and listen to other people's stories about how they've dealt with this and the tools that they've used to kind of combat it. Um, it also demystifies the patient's symptoms by grouping them as part of a known syndrome. So knowing that it's very common, so a lot of people struggle with it, you're not alone type thing. Knowing that you're not alone can be very comforting in this context for some people. Um, it separates the person's disorder from their personality and it identifies it as a treatable condition. That kind of goes along with pathologizing patients. You never want to label a patient with their diagnoses. That's why person first language has become such a big thing. So not that depressed person, but that woman with depression or that woman with anxiety. You never want to label a person by their own diagnoses because it can be very, very demoralizing for the person. And finally, it focuses on the current relationship problems that could be associated with onset and the maintenance of depression disorders. So, what in that moment could be causing these depressive disorders and how you can maintain those symptoms and keep them from making these negative effects. Um, so then that brings me to how the theory conceptualizes how counselors help clients change and the tools that they use. So this is usually drawn out over approximately 16 consecutive weeks of sessions. It normally presents a clear and positive expectation of rapid release from symptoms and improvement in interpersonal functioning. So it's expected that in those 16 weeks, you'll be able to kind of talk out your feelings and release those feelings and kind of alleviate from those symptoms of depression and kind of improve that interpersonal functioning in yourself. Teaching patients to focus on the here and now instead of stressing about the future or the past, focusing on today and how you're going to get through today, what we're going to get done today should be a priority. Instilling that in patients is a big thing as well. Tracking the patient's illness during treatment using specific measures. This goes more into the medical aspect of it, where you want to see if they're, so like say you bring someone in and you give them a Beck's depression inventory every 2 weeks of those 16 weeks, just kind of tracking how their depression would rate along the timeline of their treatment. Linking mood states to interpersonal events, some days being more depressed than others when specific precipitating factors are happening can be very common and can be very triggering to some, so that might be very helpful. Combating social isolation, making sure you're not isolating too much, you're getting social interaction, definitely helps with depressive disorders. Focusing on the reduction of depressive symptoms, the reduction of it will help elevate the mood and just get that feeling out that you're not alone and that you want to get through this and things will get better. And finally, focusing on the patient's current disputes, frustrations, and anxieties rather than those of their childhood. Much like other psychotherapies, they focus on your childhood trauma and things that could precipitate things that are happening now. IPT focuses more on what's happening now rather than what's happened before to cause what's happening now. They're just looking at what's recently happening to cause this depressive state and what we can do to fix it in this time and moment. So that's it, guys. Thank you. I hope everyone's having a great spring break. And I'll see you all next week.